Greetings, my fellow Coloradans. I want to give you an update today on where we are with COVID-19, announcement about next plans for the vaccination. I'm happy to welcome Brigadier General Scott Sherman, the Director of Unified Central Command Vaccine Joint Task Force for the state of Colorado. As we were beginning to plan vaccine distribution a few months ago, we knew that we needed to bring the right people to spearhead the effort with the right experience to handle the logistics of such a historic undertaking. And that's why we brought General Sherman into the team. He's run logistics for combat operations in Iraq, including ammunition and food for tens of thousands of soldiers. And he's been heading up Colorado's vaccine distribution efforts, coordinating logistics and planning and more. And you'll be hearing from Brigadier General Scott Sherman in a moment. I'm also glad to have Scott Bookman here with us. He's the Incident Commander for COVID-19 at the Director of the Division of Disease Control and Prevention Health Response. Scott has been a critical part of the pandemic response since the early days, and his healthcare background has been very instrumental as we work with all the health partners across the state, community health clinics, hospitals, pharmacies, et cetera. Today we're going to share some updated information on where we are with vaccines and vaccine prioritization. First, I want to give an update on the latest COVID numbers in Colorado. Testing numbers for yesterday, 1,722 new cases out of about 34,000 tests. We are glad to see that testing number go back up into the mid-30s. We feel a lot better about knowing where we're at than we did a few days ago where we had a very low testing number. But 1,722 cases, that's slightly up from the day before. The good news, 596 hospitalizations, which is 48 fewer than yesterday. It's the first time we've been below 600 in a few months. We're very grateful for that. I also want to express my condolences to the friends and family and loved ones of the 5,594 Coloradans who've died with COVID, 4,892 who have died from COVID in our state. And there are, even as we talk about all the bright promise of the vaccine, there are still losses ahead of us, brothers and sisters, mothers and fathers, friends, loved ones. And we have the ability to minimize that by wearing a mask when we're around others, by reducing socializing with people who live outside your home, and by trying to keep a distance of at least 6 feet. We have it in our ability to minimize future loss, even as we talk about the bright horizon with regard to the vaccine. So today, and before I get to the numbers, I want to speak globally about vaccine prioritization. Everybody will have the chance to get this vaccine, and it is free, but everybody can't get it at once. We'll go into the numbers of how many we get each month and each week, and we know a little bit more now about the next few weeks. The reason that we have a difficulty operating more than a few weeks out is we always want to keep the size of the group that we're vaccinating roughly consistent with the level of supply so that people are able to get it over the next few weeks. It was an easy call to say that those age 70 and up should go first, and they are still going. We've done about 40% of people age 70 and up, but there's a lot more to go, and we'll go into those numbers, and we want our goal is 70% of 70 and up by the end of February. But frankly, we hope that even more than 70% want it, especially among that age group. I'm hopeful that 80-90% of people age 70 and up will want it and have the opportunity to get the vaccine by the end of February. Many have gone already. Some are still signed up and waiting. If you are 70 and up, you have friends or parents or loved ones who are, they will get that in the next few weeks if they haven't gotten it already. Hopefully next week, which will be a very big week for age 70 and up. But we are at the point where we are getting through the 70 and up, and we are looking to expanding eligibility. The most logical expansion is, and one that we are doing, which is going to every Coloradan, every age 65 and up. That aligns with CDC guidance. While a 66-year-old does not have nearly the risk of an 82-year-old or a 90-year-old, they still have a higher risk than a healthy 20 or 30 or 40-year-old. So we want to make sure that we offer that to people aged 65 to 69 starting February 8th. After that relatively easy call, I mean, the easiest call of all is the 70 and up. People 70 and up represent 78% of the fatalities from COVID-19 in our state, and about over 40% of the hospitalizations. So when we succeed in protecting age 70 and up, which we will, first dose by the end of February. Many are already even starting their second doses. It ends the crisis phase of the pandemic. Pandemic not over, but no longer, deaths reduced by 3/4, hospitalizations reduced by 40%, no longer up against the overcrowding hospitals. That inherently is big progress. 65 to 69, easy call. We hope to be to age 60 and up in early March. We'll go through those numbers. But there's another group that we believe that is foundational to our society to function, for workplace equity, for the sanity of families with kids, and that is our educators, and first and foremost our kids' future. And we will be beginning in Colorado to vaccinate all the educators in our state beginning February 8th. That's expected to take 2 or 3 weeks. We will be using about a third to half of the vaccine starting February 8th for about 2 to 3 weeks to be able to vaccinate all the educators, childcare teachers, professionals, paraprofessionals, anybody who's in the classroom with kids. Why is that important? It's important for a number of reasons. First of all, I hope that many parents are appreciative that most of our schools are now back, not all, but most, and they're doing it in a very safe way with layered protections, which we've emphasized from the start. You can do education safely with the right protocols, with the right ways of doing it. Layered protections, meaning one on top of another. If all they were doing was running classrooms like they did last year and the year before but wore masks, it's better than not wearing masks, but it's not enough for classrooms to be safe. So it's about symptom screening. It's about wearing masks. It's about cohort isolation. It's about social distancing, 3 feet, whatever they can do where possible. It's about ventilation, as simple as an open window where possible. And it's about testing. And we are proud to announce our partnership with Binax, one of only 3 states where we are providing, offering through the districts and charter schools and private schools to provide a test every 5 days for every teacher who wants it in-home, as well as an allocation where if there are anybody who's symptomatic, they can do that themselves. But the screening testing is one of the very best protocols for preventing COVID-19. It will afford our public schools and our teachers the level of protection that professional sports teams and others have had as their prerogative through the purchase of 2 million Binax tests a week. We're extending that to teachers starting next week immediately. We're proud to be delivering those directly to homes. But above and beyond that, running public schools are hard because and private schools and all the others, because some of the very protocols that are designed and are very effective in keeping the risk low, namely quarantines, also get in the way of schools operating. And schools go back, but when there's a class out or 2 classes out or a whole school has to go online for 2 weeks, that can also be disruptive. Not just for the kids' education, because we know that many kids need that in person for their academic achievement and for their social emotional health, but also for families. We've seen a startling increase in gender disparities in the workplace and earning, as many second spouses, and often in many cases it's women, drop out of the workplace because there's no school for their kids to go to. And so to prevent those interruptions and the need for the very operationally difficult quarantine protocols that effectively lead to schools shutting down for short periods of time, to recognize and elevate the profession of educators in our society and the cornerstone that our schools of all types provide, we will be able to successfully vaccinate with a highly effective life-saving vaccine every teacher who wants it in public, private, child care settings over a 3-week period beginning February 8th. For those, if you are a teacher or educator and you're wondering how you get it, or paraprofessional, the instructions will come through your district, through your employer, through your school, and you'll have that opportunity with the provider or providers that they work with to be able to sign up and get vaccinated. Members of the general public, age 65 and up, will also have access to the vaccine, along with people 70 and up, beginning February 8th. And they can sign up with a provider near them. There is no need, if you are 65 and up, you can sign up now, but it doesn't mean you go any earlier than if you wait until February 7th or 8th. They won't start until February 8th, and it will be randomized in terms of who gets them. So try to keep those phones clear for people 70 and up, because they are our focus here as we'll get into the numbers through February 8th. Now, how do we get there? How do we know that this will work with the right vaccines at the right time for the right group? How do we know we can get through the teachers without delaying the 70 and up, the 65 and up? How do we reach our goal of 70% of people age 70 and up successfully protected by February 28th? That's what we're going to show you now. A lot of thought and analysis went into this process over the last few days, and the only reason we're able to be here and present this is because we have visibility into the next 3 weeks of vaccine supply. That was one of the early accomplishments of the Biden administration, is we finally have a sense of what we're going to get so we can plan out a little bit more. There's some planning for the early March timeframe, but again, that's going to depend on quantity. It's still a little nebulous. We're going to have to further hone it. But for now, we're comfortable in talking about where we are for the next few weeks so Coloradans can plan accordingly. As I've said many times, the COVID-19 vaccine is our path back to the Colorado we know and love. And from the onset, we've approached vaccine distribution in a way that's equitable, saves the most lives, and ends the pandemic as soon as possible. This Herculean effort to get vaccines into arms cannot be underestimated, and I'm proud that Colorado remains among the top states in successfully deploying the vaccine. And it's one of the very reasons I put General Sherman in charge of this effort. And I want to thank General Sherman, his entire team at COVID Response, and the folks at CDPHE who are going above and beyond. I also want to thank our local public health professionals for their critical work in a very challenging time. Before we even received the first dose of Pfizer back in mid-December, we've been planning and preparing for that day. And today, Colorado is one of the top states in the country in successfully getting the vaccine into arms. But this process, of course, has not been perfect. It's not about perfection. It's about getting it done, saving lives, ending the pandemic. Here in Colorado, we're doing everything we can to win the race against time, the race against the virus and its more contagious variants. And now we're ready to take the next step. I'm incredibly proud to say that 90% of our highest risk frontline healthcare workers have received both doses of their vaccine. That's essentially all who want it. We're happy with the 90% number. I hope that we get to 90% of 70 and up that want it. We expect that among the general population, it'll be more in that 70% range. But of course, healthcare workers who understand the science, who know what the vaccine does and how it protects them, I'm very thrilled that 90% have taken advantage of the opportunity and have now completed both their doses and are either protected now or shortly will be protected in the next week or two. They're on the ground. They work in COVID wards, you know, under 600 hospitalizations. That's still a lot of people in the hospital from COVID. 100% of our skilled nursing facilities have received their first dose. 71% have received their second dose. I heard from a grateful 88-year-old friend who lives in a nursing facility who just received her second dose. And is very excited that within a couple weeks she'll be able to visit and see her friends and really end the social isolation that's made it very, very difficult. And we appreciate all the different burdens that people have faced. For some, it's the health burden. They've gotten sick. They've lost loved ones. For some, it's the economic burden. Their job's been impacted. And for some, it's the social, emotional burden, especially our seniors. This means, given where we are with skilled nursing facilities and frontline workers, we are essentially moving full speed ahead with 70 and older. That is our focus right now. We set the goal of ambitious goal of protecting at least 70% of people 70 and up by the end of February. And why? It's 78% of the deaths and 40% of the hospitalizations in our state. There's about 562,000 people aged 70 and up in Colorado. If we target 70%, it means 393,639 to be precise. Now, again, we hope it's more. We hope that 80-90%, like healthcare workers, of people 70 and up will choose to get the vaccine. But we know there'll be some stragglers and a few that aren't willing to go out of their way to get it. So we'll be happy to celebrate achieving 70%. We're going to keep going from there. We've currently vaccinated 190,995 Coloradans aged 70 up, which means that we're just under halfway to our goal. Today, we should be, with the vaccinations from today, we should be halfway to our goal of protecting people 70 and up. And I know there's people 70 and up watching this who got it, of course, who had friends who got it. There's also some watching this who signed up or haven't been called yet. And you will. It could be next week. It could be the week after. You will get the chance to get the vaccine if you're 70 and up in the next few weeks. And many of you will next week. And these numbers don't even include the residents of the long-term care facilities and nursing homes. So there's actually even more people aged 70 and up that got it, but we deal with it as a separate category. We continue to have a laser-like focus on the goal of protecting 70% of Coloradans aged 70 and up by February 28th ending the crisis phase of the pandemic, reducing deaths by 75%, reducing hospitalizations by more than 40%. During that time, we will also be able to cover many of the people age 65 and up, and also ensure that our schools are able to continue uninterrupted. I'll now turn it over to General Sherman to go into more detail about exactly how we are going to make achieving this goal a reality in Colorado. General Sherman.
Thank you, Governor. Next slide, please. Good afternoon, ladies and gentlemen. This chart shows our best estimate for what the weekly allocations from the federal government will look like moving forward. This is a fairly conservative estimate, and there's potential for the numbers to be higher. We do not anticipate the supply chain to diminish forward. We've been very thoughtful on this supply, and we've researched it thoroughly. We're very confident in this numbers that we'll receive through the end of February. This estimate does include the 16% increase through the end of February that the Biden administration announced. And for the week of February 1st through February 8th, next week, that also includes an increase of vaccine that was returned back to Colorado from both CVS and Walgreens from the federal long-term care facility program. There was extra doses they did not need, and they're returning it back to Colorado so we can make sure that we get those shots into our population. So given these projected numbers, we estimate that we'll receive roughly 452,000 doses between now and March 1st. But I want to make sure that everybody keeps that in context. Colorado is a state of nearly 6 million people, so it's going to take time, and please ask everybody to be patient before we can expand access to the general public. Next slide. So this last slide I showed was the total estimated allocation of vaccines that Colorado would receive. And this slide shows the number of those vaccines that will be utilized for Coloradans 70 and older. Given these numbers, we're confident we'll be able to vaccinate enough Coloradans each week to reach our goal. The goal right there at the bottom that the governor mentioned, 393,639 doses. So we estimate there's 562,000 Coloradans over age 70 that aren't in long-term care facilities. And we certainly think with this allocation that we're getting through the end of the month that we can reach that goal and also start teachers and our 65 to 69-year-olds here after 8 February. Governor, I'll turn it back to you.
Thank you, General Sherman. And from the beginning, I've said that we would make real-time decisions based on the latest data, facts, science available now, knowing the number of vaccines we'll get for the next 3 weeks. And based on this information, we are very confident that in these changes that we're making to Phase 1B. Phase 1B subdivided. Now, of course, Phase 1B1, which is where we are right now, including Coloradans 70 and older. Phase 1B2, which is where our state will move into February 8th, includes every Coloradan age 65 to 69, as well as continuing with those 70 and up who haven't been vaccinated yet, as well as all preschool through 12th grade educators and licensed child care workers to ensure that they can continue uninterrupted. Phase 1B3 includes frontline essential workers and Coloradans who are age 16 to 64 but have 2 or more high-risk conditions that are medically indicated to correlate with CDC criteria to substantially greater risk. We also, in Phase 2, expect that we will soon, in early March, be expanding eligibility to the general public 60 to 64. So working our way down, 70 and up done by that point, early March, 65 to 69 done, and then available for everybody 60 and up, as well as Coloradans with high-risk conditions. We're hopeful that that will begin soon. Phase 3, of course, the general public, we hope early summer. Could be late spring. There's really very little I can offer in that regard in timing because it simply depends on quantity. As soon as we are able to, of course, we want to get this out to as many members of the general public as possible. But there are a lot of folks in the essential worker groups who have priority. What does that mean? It's those who work in an environment where they have no alternative but to go in, right? Your grocery store workers, your bus drivers, very important that they have priority. There are other Coloradans who have the opportunity to work from home and are members of the general public, and they will be able to get the vaccine, but we want to protect those who have no choice but to go in to work first, as well as expanding the general population eligibility to age 60 and up. To go over these updated phases in more detail, I'm happy to turn it over to Scott Bookman. Scott?
Thank you, Governor. And thank you, everybody, for joining today. I want to take the opportunity to run you through a bit more detail on our updated phasing. Here, you'll see detail on Phase 1B2, which now includes people age 65 to 69, our pre-K through 12 educators, childcare workers, and those who are critical to the continuity of state government. I want to particularly call out in the educator group that this is not just childcare workers and teachers. This is also bus drivers, paraprofessionals, safety workers, and other support services that are critical to the functioning of our schools each and every day. Next slide, please. So, in Phase 1B2, we estimate that there are a total of 408,000 people. That is 288,000 65 to 69-year-olds, approximately 120,000 PK through 12 educators and childcare workers in licensed programs, and then approximately 100 continuity of state government workers. Next slide. So, our goal is to vaccinate 55% of 1B2 by March 5th. And so we will begin on February 8th, and our 65 to 69-year-olds and our educators will be included and eligible to start receiving the vaccine. And based on the numbers that we have available to us today, we believe we will hit that goal by March 5th. Next slide. So we know that people are struggling from time to time to figure out how to sign up for the vaccine. So I want to take the opportunity today to be clear about how we want people to do this as we move lower into our phasing. So 65 to 69-year-olds should follow the path of our 70 and up. Sign up with your local provider to schedule an appointment. You can get more information on how to do that by going to our website or calling our hotline. That information is on the screen in front of you. Next slide. For those who are eligible to receive vaccine in Phase 1B2, you will sign up via your employer. And so rather than getting in touch with a provider directly, we encourage all PK through 12 and childcare workers to contact their employer to figure out how they will be vaccinated. At this point, many of our school districts and other educators have already partnered with providers and are planning to deliver vaccine to their employees. Anybody who has not been able to do that at this point should reach out to their local public health agency or a healthcare provider to start doing that work. And again, that is the educational institution that should begin doing that, not the individual employees in those facilities. Next slide. So many of our largest school districts are already undertaking that work. We know that Denver Public Schools has formed a relationship with Children's Hospital. We know that the Aurora Public Schools are working with Kaiser Permanente, Centura, and Salud to get their educators vaccinated. And we have heard that Jefferson County is working with Centura, SEL Health, and Children's. So a lot of work has already been done in this area. And again, we want to encourage educators to work with their employer, not with the provider directly. Next slide. So moving on to Phase 1B3, this is frontline essential workers and Coloradans who are 16 to 64 with 2 or more comorbidities. So when we talk about frontline essential workers, as the governor indicated, these are people who have to go into work to do their job and are essential to the functioning of our society. For example, these are food and agriculture workers, U.S. Postal Service, public transport, public health workers, frontline essential human services, faith leaders, and direct care providers for Coloradans experiencing homelessness. Also looking at people who are 16 to 64 with 2 or more high-risk conditions as identified by the CDC. Some of these conditions include chronic kidney disease, COPD, Down syndrome, sickle cell disease, and also people with disabilities that prevent them from wearing masks. Next slide. 1B3 is a large group. We currently estimate that there are over 1.1 million Coloradans in this group. That includes 750,000 essential frontline workers, and then approximately 400,000 people who are between 16 and 64 who have 2 or more comorbidities. Next slide. Our goal is to start vaccinating Coloradans in Phase 1B3 by early March. We currently estimate that date to be March 5th. That is dependent on supply and the ability to get vaccine administered as quickly as we can. More information will follow as we move through Phase 1B2. Next slide. So for frontline essential workers and Coloradans with two or more comorbidities, there are two paths to sign up here. If you are a frontline essential worker, we would have you do this in the same way that our educators will do. So work with your employer to ensure that you have access to a provider who is able to give you the vaccine. And we are continuing to work with stakeholders to ensure that those who do not already have a relationship with a provider, we will facilitate that happening. For Coloradans with two or more comorbidities, we do anticipate that they will be handled in the same way that our 65 to 69-year-olds and our 70+. More information to follow there. Next slide. Governor, I'll turn it back over to you.
Thank you, Scott. And I want to make something clear. Of course, we want to reach and would love to reach 100% of these target groups. We would love if 100% of people aged 70 and up and 65 to 69 and teachers receive the vaccine. We're happy with the numbers of 90% of healthcare workers, and that's probably a high watermark. For many other groups, it'll probably be in the 70-80% range. But we plan based on the reality and the likely scenarios. And so by setting the goal of reaching 55% of the target group by early March, we then want to open eligibility for the next round, or we risk then slowing down the administration of the vaccine, because once you're at around 50-55%, as we're getting very close to a 70 and up, sure, there continues to be a reduced trickle of those for a few weeks, but you really need to open it up to the next group to ensure that you're not slowing down the utilization of the vaccine. Of course, our top priority, getting it into arms, working with our providers within 3 days of when they receive it. So we're working to manage supply and demand. We have visibility on where we are, certainly for February. I think that March is likely to be updated again in terms of the exact date and pool, but we gave you some general parameters about our early thoughts, and that'll be informed by actual number of vaccines that we receive. The trouble that many other states have run into has been a very rigid vaccination system, meaning they have they would wait if a state would wait till everybody's 70 and up was done. In that last week or two of 70 and up, you have a lot of vaccine being unused because you're trying to find the smaller the members that are left of a smaller and smaller group. If you're 70 and up, you're going to get it in the next week or two, and it doesn't mean there won't be a few stragglers that maybe were on no list or the wrong list through late February, but most of you are going to get it in the next week or two. Teachers, educators, just because we have that February 8th date doesn't mean that, February 9th, everybody's going to get it. It's over a 3-week period that every educator will get that, and many of them in 2-week period, but we're really, for the quantity of the vaccine, it'll take about a 3-week period where you'll have the opportunity to do that. To summarize, we've completed vaccinations for phase 1A. It's not possible to reach 100%. We're at 90%. We're happy with that. Highest risk healthcare workers have received the vaccine. I want to point out that if you're someone who should have been eligible under 1A and you change your mind, you still want it, doesn't mean you're out. You can still get it. If that 90% increases to 91 or 92%, that's wonderful. So you might have been out of town or sick, or maybe there might be good reasons, like you just got over COVID and you want to wait a month or two till you get it. You're still eligible. We're also on our way to reaching our goals for phase 1B2, the top priority to save lives, people over 70. We're confident that anybody who wants it over 70 will have that opportunity by the end of February, and we're hopeful that that's over 70%. I think it will be, and we would love, especially for those over 70, we'd love to reach 80 or 90%. That might take a few more weeks for those who want to wait a little bit, but hitting that 70% is critical, and we'd love to go higher. And I'm very excited that starting February 8th, across Colorado, everybody age 65 and up will be able to receive the vaccine. It is free. You can receive it locally. Your number might not come up the day after you sign up, but you will have it, whether it's a week or 2 or 3. If you're 65 and up, I have a high degree of confidence in saying that you'll be able to receive the vaccine during February, no matter where you live in our state, as well as making sure that we protect our education heroes, our preschool through 12th grade educators and early childhood providers, whom are so critical for the successful function of our society, for workplace equity, for families who have to work, for the future of the kids. It's so important that we facilitate the return to in-person education, just as we have with providing millions of free medical grade masks to schools, Binax testing to schools where every teacher can be tested once every 5 days on a cadence recommended by the CDC. the well thoughtful protocols developed around cohort protection and ventilation and distancing, and now to prevent interruptions necessitated from quarantines and provide that additional level of protection, vaccination. In early March, March 5th, but we hope, I'm optimist, always hope it's earlier, but that, if we don't get any different news, March 5th around there, frontline essential workers, Coloradans aged 16 to 64, 2 or more high-risk conditions. Around that date, every Coloradan aged 60 and up. We'll have more information on that. It really just depends on vaccines. I think there's 2 errors here that some states have made. Some, as I mentioned, define the eligibility group too narrowly, slowed down their vaccines, they're sitting on shelves. Other states have opened it up too quickly, which is probably not as bad a problem as being too narrow, but it's very frustrating for people because the list is so big that it feels like nobody's getting it, even though they are getting the vaccine out, and people would wait many, many months. We hope that by doing it this way, nobody who's up has to wait more than a few weeks. If you're 70 and up, you'll get it in February. If you're 65 and up, you'll get it in February. If you're a teacher, you'll get it in February, rather than lead on people who won't get it in February by saying that they're now up when they're sort of de facto not. So we're trying to align this in a way where if it's your turn, and by the way, when it is your turn, get the vaccine. Don't feel guilty. Don't feel you're not worthy. You are. We need to get it to you to protect you. Get the vaccine when you're up. And hopefully when you are up by nature of your age or your employer, you'll be in a few week period that you'll be able to be successfully vaccinated. Anyone looking for more information can visit covid19.colorado.gov, covidvaccine.org, covidvaccine.org. We have a toll-free number, English y Español, 877-CO-VAX-CO. And at either of those resources, you can find how to sign up, to be on a wait list. I want to reiterate, if you're 65 to 69, you sign up just like our friends over 70, sign up at a hospital or community health clinic near you, and you will have the opportunity in the next few weeks to get it. The numbers aren't such that if you're 66 years old, you won't be able to get it February 9th for sure, right? There's a 3-week period through February that you will be able to get the vaccine. Some will get it February 9th, some will get it February 27th. It will be randomized. There's not preference based on who your provider is or who your insurance is. Everybody's equal access. And you will have the opportunity to get the vaccine. For our pre-K and kindergarten through 12th grade educators and staff, work with your employers. You do not sign up on one of these public sites. You will have a link that will be from your employer to sign that up. As a subgroup, it'll be up to the employer which providers they work with and how you sign up. So it'll be different in each district. So just stay tuned. Expect that email. In or around February 8th to be able to schedule that. And know that also means for you. It means sometime in the next 3 weeks you'll be able to get that. Most in 2 weeks, some in 3. And please, this message is for everybody eligible to receive the vaccine. If you have an appointment, show up and get it, please. They'll use the vaccine, but it might go to a lower priority group. Show up for your appointment. And also, the converse of that, don't just show up if you don't have an appointment. They're not taking walk-ins. There's more demand than supply. We get that. Sign up if you're in the eligible group. You'll get it very soon. And taking walk-ins, our partners wanted me to pass along. It puts a burden on them because they don't like to be in the position where A, extra people are sort of loitering around, and B, they have to tell you, no, we don't have it. So wait till you're up, and then do show up, and make sure you have that appointment. Colorado, this is the big next step. Since we're at about half of the goal for 70 and up, we're ready to announce on February 8th, we're moving on to be able to get anybody age 65 and up vaccinated, along with our teachers and educators that so many of us rely on for our kids' future and for our work today. Since the early days of this pandemic, our decisions are driven by data and the best information we have. Any of these are subject to change if there's additional or different information we get about the number of vaccines that we will be receiving in a different week, and today's announcement is no different. Every vaccine administered is one step closer to ending the pandemic. And I want to thank General Sherman and Scott Bookman for joining us here today, and I'm happy to open it up for questions.
Hey, Governor, this is Seth with the Gazette. 2 questions for you. First, if workers in homeless shelters are going to be included in the next phase, why doesn't that include people experiencing homelessness, which is something Denver wants to do? And second, The CDC has said that corrections staff and inmates should be vaccinated at the same time because of their shared risk, which most of the states are doing. Why is Colorado not doing that? Thank you.
So, yes, everybody who is experiencing homelessness who's over age 70 is currently eligible, has hopefully been vaccinated. On February 8th, that will expand to people age 65 and up experiencing homelessness. And it is the same with our prison population. Every prisoner age 70 and up has been vaccinated. We have 573 inmates that are age 65 and older, and they will all be vaccinated right after it opens up February 8th to them. We believe on these really the risk-based criteria for saving lives, and that's why we've prioritized and are leading many states in protecting our most vulnerable, age 70 and up. And if you're 70 and up, it doesn't matter if you're a millionaire or you're homeless or somewhere in between. You are at greater risk simply because of your age. And that goes the same for, again, whether you're in prison or whether you're on the outside or whether you are healthy or not. Age itself is a risk factor. And we're all going to breathe easier when we've successfully completed the vaccination of people age 70 and up, because it represents 78% of the fatalities from COVID in our state.
Good afternoon, Governor. This is Stephanie Rodriguez with the Bookman number. ¿Podría compartir el mensaje y la actualización de hoy en español? Y también otra cosita, ¿cuál ha sido el obstáculo más grande hasta el momento?
Hoy anunciamos que los maestros de kinder a secundaria y jardines de niños podrán vacunarse empezando el 8 de febrero, al igual que las personas mayores de 65 años. So, hasta la fecha, el 8 de febrero, empezamos a ofrecer la vacuna a toda la población mayor que 65 años y también todos los maestros de las escuelas.
The vaccine phases have changed now 5 or 6 times. I wonder if you're worried about folks in the community not knowing when their phases are coming up or being extremely confused. How are you getting the message out on that? And then I also wanted to ask, if the state has had any issues or providers have had any issues with the vaccine going to waste because people aren't showing up for their appointments, as you mentioned.
Yeah. So first on the waste issue, we have very clear instructions that if there is a dose that would otherwise be wasted, we support going in a different order than the official vaccination order. So the highest level guidance is use every dose. There should not be any doses wasted in our state. If for some reason you have an extra dose and the person over 70 didn't show up, you do vaccinate the spouse who's 62 or somebody who is a healthcare worker who didn't get it yet, who's in the building. And so every dose is used. That doesn't happen very much because the vials are 6 for Pfizer and 11 for Moderna, but it could happen with a few doses at the end, and those should be used. That's our guidance. We have a great deal of confidence in the guidance we're issuing now for February for the next few weeks. It is likely that the March guidance will need to change again based on the quantity of vaccine that we get. As General Sherman indicated, I think there's over 1 million people in that group. If the level of vaccine doesn't increase, that group will likely need to be further parsed because there will be simply too many frustrated people in a group of 1 million people. If we're still only doing 90 or 100,000 a week at that point, people could have a 2-month wait. So we will update that based on actual data. But I think what our focus is today is we know where February is. We have a good sense on this. There's a little upside potentially. We're conservative in our estimates. If we get more vaccine, we can go a little quicker. Maybe March 1st rather than March 5th. We'll see. But we feel very good about the February 8th date based on supply. And we have a great degree of confidence that this works for our state for the month of February. Follow up, Josie?
Hi.
No. Okay.
This is Anusha with 9 News. Specifically for when we do get to 1B3 and for those with 2 or more comorbidities, will people have to show any kind of documentation or proof of their health conditions to be eligible for the vaccine?
Yes, generally speaking, those protocols are being worked on now. Many of the vaccines are administered through healthcare providers, many of them through the hospitals in which that person may be a patient and may receive regular treatment. So the medical records should be there, but there will be some way where if they get it in a location other than where their medical records are, that they're able to demonstrate that they have those two pre-existing conditions that put them at much greater risk to COVID.
Hi, Governor. Dave Perry from Sentinel, Colorado. With the reduction in the level of transmission right now, is contact tracing still a priority for the state? And if so, are state officials able to glean anything about what kind of activities or places or demographics are most likely to cause transmission at this point? And related to that, is the state recommending double masking?
Yeah. So let me first say that while the trend has been very positive in our state, the prevalence of COVID is still very, very high in Colorado. We're at about 1 in every 114 people in our state are contagious with COVID-19 right now. And that's why it's so important to take precautions like wearing masks, avoiding social gatherings, trying to remain 6 feet from others where you can, because we want to continue to move in the right direction as we rapidly move to vaccinate everybody who wants it in the coming months, not the wrong direction. And one of the reasons it's so key to protect people age 70 and up is, of course, yes, people are getting it today. It is in our communities. But if, God forbid, there's another spike or increase, while it would be devastating, we could potentially have more than 75% less deaths, even in a spike scenario, if the people that are age 70 and up are protected at that very high level. You asked about double masks, and what was the other question you had there, Dave?
If the contact tracing is showing kind of which demographic is most responsible for transmission, or if there's
Yeah, and we'll be happy to have, I'll have Scott address that, but I think the best person, Dave, is Dr. Rachel Herlihy, and we can schedule you. She sometimes appears with me at these, and this one's more focused on vaccines, so she's not here. But I'll go to Scott briefly on that, and then we'll set you up for a phone call with Dr. Herlihy. Scott?
Thank you, Governor. Our contact tracing and case investigation at this point is really yielding that we still see transmission in any number of different environments. And so what we really continue to encourage people is it is critical to wear a mask, keep your social distancing, and limit interactions until we have gotten through enough vaccine to move on to the next phase of this.
I think, we'll set you up with Dr. Herlihy, but I think something that would be added is that when the rates are this high, which they are across the country and in Colorado, 1 in 115, it's harder to pick up patterns and in fact outbreaks when they could have got the source of infection from multiple sources. It becomes easier when the rate is lower. So we'll set you up with Dr. Hurley to discuss that. People can absolutely wear multiple masks if they want. Some wear cloth masks. I wear a surgical mask for those who want a higher level of protection. They can wear a KN95 mask. We have been providing free masks for our teachers for now several months. We provide every teacher a KN95 mask each week for the highest level of protection. But recently what we've heard from many teachers is some use it, but many would prefer a surgical mask, which is not as good as a KN95 mask, but is probably slightly better than just a regular cloth mask that somebody might make at home or wear. And so we have added those to the availability. So teachers can choose to have a surgical mask or a KN95 mask. And of course, many also choose to wear their cloth mask with their school mascot or colors. They're certainly entitled to do that as well. People are welcome to wear 2 masks as well. There's some evidence that it provides additional instructions. Certainly for those wearing KN95s, a filter with an extra level of protection or inserting a filter into a cloth mask that allows that can effectively increase its effectivity. But what we really care about is the general mask wearing as a whole. You're welcome to wear the mask that best suits you, whether it's cloth, surgical, KN95, or double.
Thanks.
Hello, Governor. Jesús Carrasquel from Noticias Univisión Colorado. Gobernador, en español, ¿puede darnos una actualización de los importantes anuncios de hoy y si garantizaría las vacunas también para ese llamado turistas que vienen de otros estados a colocarse la vacuna?
Sí. Todos los residentes de Colorado mayor de 65 años pueden recibir la vacuna después del 8 de febrero. Ahora, todos de la edad de 70 años o más pueden recibirlo y hasta el 8 de febrero más gente mayor que 65 van a recibirlo y también los maestros pueden recibirlo después de el 8 de febrero. No necesita identificación oficial, pero es mejor traer algo con su fecha de Navidad, como un pasaporte o como un identificación consular o identificación del Estado.
Hi, Governor. Jason Gonzalez with Chalk Beach, Colorado. I have a few questions for you. Can you please go over again what made this possible for teachers for them to be vaccinated on February 8th?
Sure. First and foremost, the awareness of the number of vaccines we would be getting in the next few weeks, and the knowledge that this would not interfere with the efforts to protect our most vulnerable over age 70 and expanding to age 65 and up on February 8th. Secondly, the foundational importance of education. Of course, first and foremost, for the kids, and we know that online has been very difficult and only accentuated some of the existing inequities in education. But in addition to workplace equity today, ability of families to support themselves, social emotional health of both kids and parents, it's really, our schools are a cornerstone institution of our society, and it's important that we, just as we have focused on them returning safely to school, that we're able to keep our schools in person in as safe a way as possible to have as normal a spring semester as possible during the pandemic.
And then what was the decision-making process and making them eligible ahead of other essential workers?
Yeah, so every worker is essential, but when you talk to and hear from folks in grocery stores and bus drivers or folks that work in offices, one of the big things you hear is, I'm having a lot of difficulty figuring out how to continue going into my job if my kids don't have school. And so it is foundational to equity across the entire economy, and especially for essential workers who have to go in. Quite literally, what if you're a single parent and you have a 7-year-old and you have to go into an essential job that you can't telecommute to? You faced a very tough decision. You've had to either quit your job or find some kind of informal or formal childcare that you might have to pay for your kid. It's been very difficult. And our schools are key to have back, first and foremost, for the kids and their families, but also for equity across society, including addressing the increase in gender disparities in the workforce, as many women have dropped out of the workforce with the lack of in-person education.
And last question, do you know or have any idea when higher education might be eligible, especially in community colleges where many of those professors have to be in person?
No date yet. You still have some of those arguments, but not all. Of course, it's important educationally, although probably less so than it is for a 6-year-old or a 5-year-old, with high schoolers probably being somewhere in the middle. Less important from a workplace access type of view, namely our community colleges are not daycare centers. 19 and 20-year-olds are perfectly capable of taking care of themselves. If they do live at home, their parents can work without worrying, unlike a 7-year-old. But of course, we want to vaccinate everybody as quickly as possible, and that all depends on supply. And we know that many of our community college students themselves have young children and rely on education to be able to continue their own education and job as well.
Governor, Jason Grenauer here with Denver 7. If the 70-plus population is the most at risk, as of right now, that population is only about 34% vaccinated. Why not get that to a higher number first before opening things up to lower ages and educators?
Well, we will be, and that's why the date of this change is effective February 8th and not tomorrow. We expect to be around 50%, over 50% around that date. And so what happens when you get to about 50% of the eligible group, and will likely be, as I said, between 50 and 55%, is it starts to slow down, meaning everybody who's on a list has gotten it or will get it soon or is scheduled. And there's some more that will get it, but it's a little bit slower. They trickle in. You have to go and call them to set up appointments. The people who really wanted it, who signed up, are the easy ones, are already vaccinated. So it's really important to open it up before you get to 70%. If you wait that long, you're going to have a 2-week or 3-week period where you're just not administering as many doses as you get, because there's not enough people that you can find who meet that rigid criteria to do it. So we need to reach 50 to 55% of 70 and up, expand it, finish up the remaining 70 and up in the coming weeks, find additional 70 and up, but certainly we don't want to slow down administration of the vaccine just to find every last person in that dwindling pool. Follow up?
Governor, Chris Vandermean with 9 News. I'm actually going to phrase my question for Scott Bookman, or if anybody who wants to answer it. Do school districts need to start game planning for having teachers get vaccinated? One, because they need to take time to get vaccinated, and two, because the inevitable mild symptoms that seem to come, particularly from that second shot, you've now sped up the process for them. Should school districts be getting ready for some time off in the next month or so?
So in general, the symptoms that most people have after receiving the vaccine are mild. That being said, in our healthcare workers and in other populations, we are encouraging employers to stagger when people do get their vaccine to ensure that they don't lose a large section of their workforce for a day or two if people have those symptoms. So we will encourage our employers and our providers to ensure that staggering is happening to mitigate any of those potential problems.
Hi, Governor. This is Andrea Dukakis with Colorado Public Radio. And apologies for the few-part question here. I wondered how the distribution of the vaccine will work by district, and also whether the group includes private school teachers, childcare, and are high school teachers receiving any prioritization?
It includes all educators, private, parochial, licensed childcare, K-12, preschool, all are part of this immediate phase. The details on each group are worked out by their employer. So in the case of a school district, they tell us which provider they're working with. We get the vaccines to them over the 2 or 3 week period to vaccinate their entire student-facing group. So it applies to educators, paraprofessionals, anybody student-facing. Some members of admin, like a superintendent or a literacy coach who is student-facing and goes into the schools, would receive it. If they're purely admin and work in the office, then they are in a later group. So all education and the district or the private school or the charter school, charter schools can either do it through their districts or on their own, get us the provider they're working with, and then we will get them the vaccine over a 2 to 3 week period to make sure that everybody in that group is successfully vaccinated. What was your second question?
Oh, well, I just actually have you talked to local public health folks about this change, and what are you hearing from them?
I think you had another one too. I can't remember what it was, Andrea. What else did you ask?
Let's see. I think we're okay.
Okay,
high school teachers
high school.
prioritize.
Yeah, no, it's all districts can decide how they want to do that. But given that from our perspective, everybody's over a 2 to 3 week period, we've not made further sub-prioritizations in there. Certainly districts within their discretion can schedule different types of schools at different times. But from our perspective, it's all being done in a 2 to 3 week period, and that's pretty darn quick. What was your final question? Oh, health departments. Yeah. So we've received a lot of input and suggestions from local health departments. I think many of them see the value in K-12 education and reducing interruptions and reducing the need for quarantines. When you look at the broader public health picture, we know how important schooling is. It's important not just academically, and I always want to say first and foremost it is important for kids' success in their future, but beyond that, for the social, emotional health of kids. We've seen in some areas, increased depression and suicides. It's important for families. It's really important across the continuum, academically and social, emotionally, and economically for families with two working adults in essential jobs that have to go in, and single parent families.
Governor Felicia Rosari with 9 News. With Johnson & Johnson announcing they plan to apply for emergency use as soon as next week, what would a third vaccine mean for Colorado? And is there any concern over its lower efficacy than Pfizer and Moderna?
We are so excited by today's news, and actually on a governor's call today, I brought this up with the administration in that while we don't have the date yet that they will get their emergency authorization for use, please tell us what we can expect in that first week of the Johnson & Johnson vaccine so we can plan for it, whether that first week is late February or early March. How many will we get? How many will be distributed that first week, and what will be the cadence afterwards? Then we can. This plan that you saw today is absent that. That's why Jesse, asked, will it change? Yes, all the stuff in March will change because I hope Johnson & Johnson will be approved. And then we'll look at the numbers, which we don't have yet, and then we'll build out the prioritization based on what we're going to be receiving. It is the more tools in this arsenal, the better. I hope it's approved right away. You mentioned while the efficacy might be lower, it also has an advantage, and that is it is one dose and protection begins sooner. So there's advantages and disadvantages, but certainly the fact that it's only one dose and protections begin sooner make it a very powerful weapon. And I hope that AstraZeneca gets approved. The more vaccine we have, the sooner we end the pandemic in Colorado. And we will look forward to seeing what those numbers are and integrating them into the next phase of our plan. But we don't expect that to affect February numbers. We're confident putting out what we put out today. We'll get it done. We'll protect at least 70% of people aged 70 and up by the end of February. We hope to achieve similar numbers for people aged 65 and up, and any educator or teacher that wants it to prevent disruptions in in-person education in our state.
Governor, this is Gabrielle from Fox 31. 2 quick questions for you. The first being that some teachers may still be skeptical to go back even with the vaccine. So does the state have any new plans in place to protect teachers beyond the vaccine? Second question being that outbreaks continue to be an issue in Colorado state prisons. So if the state won't provide vaccines for prisoners, are there any plans to increase distancing efforts there?
So we are providing a lot of protections for teachers. The vaccine is just one of those, but I think that the others that are layered together are as effective, if not more, than the protection from the antibodies. That includes free masks, both KN95 masks if teachers want to wear them, surgical masks if they'd rather wear that. It includes symptom screening protocols for families. It includes cohort isolation to reduce the number of people that are exposed to people. It includes ventilation and social distancing protocols. And then the new one that we announced is the Binax testing partnership that allows every teacher to be tested once every 5 days, delivered right to their home. And all of those combined make schools one of the safer workplaces relative to other essential workplaces. And of course, with the added protection of the vaccine, we will be able to avoid the disruptive quarantines that knock out teachers and faculty for periods of time. Of course, the students will still need to have the right quarantine protocols, but a teacher that teaches 3 cohorts of 25 kids previously, if a kid in one cohort had it, the teacher would be out for 2 weeks along with that cohort, leaving 2 cohorts without a teacher. Now, the cohort will be out for 10 days, but the teacher will be able to be in person for the other 2 classes that he or she has. So very important progress in preventing disruptions and interruptions to in-person education here in the spring semester for our kids. What was your second question?
Second question was about the outbreaks in state prisons. If we aren't going to vaccinate prisoners, are there any other plans for increased distancing there?
Yeah. We've already vaccinated every prisoner age 70 and up who wants it, over 200. We have 573 inmates 65 and up that will all be able to receive it the week of February 8th. So protecting our most vulnerable, because if you're 25 years old or 30 years old, you are at much lower risk than somebody who's 70. And that's whether you're work in a grocery store, whether you're a teacher, whether you're in a prison, or whether you're working in an office. You are at a lower risk. It is not there's still a risk for people of all ages of this virus, but it does not make sense to divert life-saving vaccine from people over 70 to protect people that have substantially lower risk simply because they're in our prisons. Thank you.